Hello, I'm Sarah Stewart of the American Journal of Managed Care.
And I'm Brian Haug. Welcome to the Week in Review from the AJMC Managed Markets News Network.
Consumers can expect to pay more for healthcare in 2016, and they need to be realistic about what they'll get for their money. That's what a top executive with Blue Cross Blue Shield said this week when discussing how the influx of 14 million new customers due to the Affordable Care Act would affect prices. Kim Holland, Director of State Affairs for Blue Cross, said many newly insured have health problems that have gone untreated for years, which will cause rising costs for payers in the near term. You cannot have every doctor in your network, very low copays, broad benefits, and lower costs. It just cannot work that way. AJMC spoke recently with Carolyn Quattrocchi of the Maryland Health Benefit Exchange about the challenges of working with consumers who have never had health coverage.
The people we're trying to reach are those who've often never had health insurance before and don't even sort of understand the basics about what it can really bring to your life and what it can do for you and how to use it and what kinds of things you need to think about to make a good decision for yourself and your family.
Our next story comes from New Orleans, where the American Urological Association held its annual meeting last week. Dr. Ryan Wernz reported on the fallout from the controversial 2012 change the U.S. Preventive Services Task Force made to recommend against widespread prostate cancer screening. A study of primary care physicians at Dr. Wernz's health system found that new male patients over age 40 receiving a PSA test has fallen by 50% since the guideline change. Some predict an increase in metastatic prostate cancer among men aged 50 to 70. But Dr. Otis Brawley of the American Cancer Society said the shift means doctors are taking more time to help their patients understand the benefits and risks of tests.
A new study in this month's issue of the American Journal of Managed Care calculates the high cost of uncoordinated care for the first time. After creating the first ever fragmentation index to measure the costs associated with poor care, researchers put a price tag on the problem of over $4,500 over 3 years for patients with chronic conditions. You can read the article at ajmc.com. CMS is demanding that providers and ACOs do more to coordinate care, in part to improve medication adherence, especially among those with diabetes. At our recent conference, Patient-Centered Diabetes Care, Dr. Trishan Panch of WellFrame talked about the link between coordinated care and getting patients to take medications.
Obviously, the patients who most need to take those medications are least able to take them because they have barriers to getting the medication in the first place, and then in terms of taking them, they're really confusing and they're getting medication from lots of different sources. And I think the medication adherence problems are emblematic of coordination problems in the health system at large.
At the Centers for Disease Control and Prevention, the focus is on halting prediabetes before it gets worse. In the new issue of Evidence-Based Diabetes Management, CDC's Dr. Ann Albright writes about the need for a two-part approach with lifestyle interventions at the individual level and a population-wide effort for all stakeholders, including payers. A partnership between CDC and the American Medical Association called Prevent Diabetes Stat began this spring to enlist community groups, commercial insurers, and major employers to broaden access to the National Diabetes Prevention Program. You can read Dr. Albright's commentary at ajmc.com.
Finally, it's not too early to register for the Patient-Centered Oncology Care meeting, which will be in Baltimore November 19th and 20th. From the President's Precision Medicine Initiative to the changes that will come with FDA regulation and diagnostics, we will cover the issues that mattered most in value-based oncology. To register, visit our conference page. For the Managed Markets News Network, I'm Sarah Stewart.
And I'm Brian Haug. Thanks for joining us.